it's been around for a few years, and it was really a sort of coming together of minds and ideas, where as the STP, as it was then, and now the Integrated Care Board is forming, and we were looking to do things regionally, was one of the drivers. The librarians themselves are a great profession and really felt that they weren't getting the credit and the visibility they required, and they were trying to develop their own profession, not just being seen as, you know, the people stuck in a library handing out books and giving some advice on how to access journals, etc., but really growing their knowledge translation skills, and also, to be really honest, thinking about how we could do things effectively and how we could do things once. And that really is how it started. So that's some of the aims on it, in how can we utilise the librarians, the knowledge people in the region once, and align to those key priorities, so as we're avoiding duplication and adding value in the system. And by adding knowledge, because knowledge from research is one of the statutory duties of an integrated care board.
Would you tell us a bit about some of the successes of STEMClub? What's worked well?
Like many things, actually bringing a group of people with a common purpose together has been really helpful. So it's not just librarians, but we've had people who are supporting commissioning and decision making. We've had people from public health who bring that knowledge aspect. So bringing them together has really worked well, but also being able to align them with some of these key priorities. So we started with like frailty, with mental health. And I think what's worked well is actually some of the librarians really feeling they've got some added value to give, not just within their trust, but sort of broader, and being able to share with other professions and other people what they can do. And I think that wider visibility, I think, has really been working well, and it's got the idea to other people.
So the opposite of that, I guess, what would you say have been the main challenges?
Yeah, nothing ever goes as smoothly as you particularly plan, and we did have something called COVID in the middle of it, which stopped the physically getting together, but we did keep it going, online, and that was good. But I think some of the challenges are, I suppose, people are, the librarians are doing this as part of the day job. They're trying to juggle all their other responsibilities, and they've really stepped forward to do it. So there's a challenge of how do you still do something within your own trust, but still have permissions and time to do something across the region and contribute to that. I think also, we've got a mix of people, and everyone's coming with a slightly different agenda, and it's just getting to know where it, is that sort of, storming and norming and getting to understand each other and what that added value is. So it's taken a bit of time, and I think the other thing that's taken time is that we've only really got into a couple of the work streams, not as widely as we might like. So getting more people to understand the importance of having that librarian, that knowledge person around a table or a virtual table, to be adding that knowledge and understand what the decision makers need, has taken time for people to recognise and accept that, whereas the couple of work streams that we have got in, it's been a really successful model.
I'm thinking now about the new integrated care system landscape as we are now. How well does the STEMClub model work in that environment?
Well, at the moment it doesn't, but I think it ideally should, because it really fits all the thinking about working as a system. And I think the other thing about librarians is that the knowledge strategy said that everybody in the NHS should have access to a librarian and to a library. I think that from a system point of view, I think it should fit, and we've started some of those conversations. I think it absolutely should fit at system level, and I think it also fits around making sure that we're making effective use of that workforce across the whole of the system. And actually, really importantly, we've got a system, as all systems are, that are really challenged. They've got some really difficult decisions to make. We all know the pressures in the system, and they're going to have to really look for that evidence more and be really robust in their thinking and decision making. And therefore we really need to think about those librarians from that perspective, as well as think of them as, the evidence suggests they're a cost-effective method of actually obtaining the evidence, presenting that evidence, and being part of that evidence sharing environment. They cost less than our medical staff, and therefore you should be using the people and the skills appropriately.
What would you say are the opportunities from the new ICS landscape for librarians?
So I think there are great opportunities. I think the opportunities are working system level, working outside those lovely hospitals they work in, and working to really add value to those difficult decisions that are going to be made in order to improve the health and care of the population in North East North Cumbria.